Hello everyone, my name is Edward. I am a therapist at the Center for Integrative Health, and today I want to talk to you about pain. So I'll be describing different aspects of pain, how pain in people can develop into a disorder of chronic pain, the prevalence of chronic pain in the United States, and different strategies that you can use in order to manage your pain, and different strategies that we use as therapists to help people with chronic pain. So first off, chronic pain can be defined as having pain for 3 months or more after the injury has already healed. In the United States, it's thought that adults, about 8 to 40% of adults in the United States have chronic pain. So that totals up to be about 100 million people. So it's very prevalent. There's a lot of people that have chronic pain, so we want to help them. There's different theories that kind of describe how chronic pain develops. So here I'm going to present one. So let's just kind of get right into it. So the idea is that this circle basically tells you the relationship between pain and different factors that then lead to the development of chronic pain. So for example, let's say that somebody experiences pain, and this person is already prone to have chronic pain. So then after they have the pain, they have a fear of having an injury, or having a fear or re-injuring a certain body part because they might have had an injury in the past. For example, somebody might injure their shoulder, so they might not move it because they're afraid of injury. So that kind of goes down to this one. So they're afraid of moving it because they're afraid of re-injuring it or injuring it. So over time, that leads to people moving that specific area less and less, right? If you're afraid of re-injuring a certain part of your body, you're going to protect it and you're not going to move it a lot or at all. You just kind of cradle it, protect it. And even though this feels natural in the short term and it's a good strategy, in the long term, if you overdo it over months and over a long period of time, the muscles that help you with those joints and they activate and do the certain things that they're supposed to do, they start to become deconditioned. So they become weaker, they atrophy, you're not using them, they die out. So the whole joint becomes weaker and all the muscles become weaker. So that actually leads to more pain when you actually try to use that in the future. And then that leads to, again, to fear of injury, fear of re-injury, fear of movement. You move it less, and then it becomes deconditioned even more. So this starts to cycle until someone develops chronic pain. So you can easily see how all these factors contribute to the development of chronic pain. So as psychologists, we deal with person's thoughts, person's behaviors, all these different aspects. So what we would focus on is things like right here, the fear of injury, and here, the fear of movement. So certain things that we would do is to try to have people confront their fears and maybe move in a safer way, and know that they will not either re-injure themselves or they just kind of accept that the pain is going to be part of their life. One way that we do this is with a certain therapy that we call ACT. So what this therapy does is, well, first off, ACT is an acronym for Acceptance and Commitment Therapy. So the heart of this therapy is that certain individuals have chronic disorders that you might not be able to cure, right? So these people might live their entire lives with this disorder. So that might be the acceptance part of it, that you might not get out of it, that you actually have to live within the limits of your disorder. Commitment is that even though you're living with that disorder, you're committed to living your fullest life, right? It's very focused on values and transforming your life into something that you love the most. And then the T is just therapy. So what ACT would do in these situations in order to avoid kind of this fear of re-injury and fear of movement is having people really look into their values and looking into what is worth having this pain for. A lot of people note like families, playing with their grandchildren, walking their dog, doing something that, yeah, it might be painful and yeah, it might be a little bit distressing, but in the end, they're building their life to be something that they enjoy and that they love, and that they're not really stuck or being overwhelmed by the fear that is kind of part of this pain cycle. So a strategy that you might be able to use if you have chronic pain and you're looking up for a little bit of guidance is to note, what do you value in your life? What do you want your life to look like? You know, what is the most important thing for you to do? And just note that you might have to structure your life in a way that, yeah, pain might influence these things, but it should not stop you from doing them. It might stop you from doing it a little bit less, right? You might have to do it a little bit less, but it should absolutely not stop you from doing it at all. For example, if you really want to play with your grandchildren and you have chronic pain, the good idea is to actually play with your grandchildren, but maybe limit the amount of time that you play with them because your either back or knees or shoulder or something might start to hurt. So over the course of several weeks, if you go to somebody that does ACT therapy, if you go to a therapist that does ACT therapy, over the course of about, depends, but usually 12 to, let's say, 18 weeks, we would try to harness all these different activities to make your life a more enjoyable life. Thanks so much.